to kindly write your questions, if any, in the chat box. The first session is by Dr. Vidya Patil, who belongs to Bidar district of Karnataka. She studied in military schools of different cities. Her father is a retired Air Force officer. She completed MA in English from Gulbarga University, Kalaburgi. After completion of BA, she worked as the principal in a public school. Madam obtained her PhD under the supervision of Professor V.R. Badigare in 2017 from the same university on the topic Paul Scott, a major British novelist. Madam attended several workshops, seminars, and conferences. She has published a book on Paul Scott and several articles in the leading and national, international journals. She has also delivered special lecture on English language and literature, personality development, communication skills, and gender-related issues. At present, she is serving as assistant professor in English, Government First Grade College for Women, Bidar, Karnataka. Dr. Patil, Madam, will speak on the topic COVID-19, lifestyle changes and women. Over to Dr. Patil, Madam.
Thank you, sir. Thank you for the very warm welcome and introduction. Good morning, everybody. It is really indeed a great pleasure for me to be with all of you this morning. I'd like to wholeheartedly thank Professor Omkar Kakde, sir, the Honorable Vice Chancellor of Karnataka State Akka Mahadevi Women's University, Vijaypura, and Dr. Gangadhar Sonar, sir, the Organizing Secretary of this webinar, all my co-panelists, the distinguished resource persons, and all the participants. I'm really thankful to the organizing team for providing me this opportunity to participate in this webinar. Now, as you are all aware, the topic for today's webinar is COVID-19 pandemic and Indian women. I'll just share my presentation. Yes. So the topic for today's webinar is COVID-19 pandemic and Indian women. So all of us know that this pandemic has irrevocably changed the world around us. This webinar aims to try and understand how the coronavirus has impacted women in different ways. I would like to congratulate the organizers for selecting such a relevant subject matter and initiating a dialogue on such issues, which is really the need of the hour. My topic for today is lifestyle changes and women. I'll be speaking specifically about how gender equality is being affected by the coronavirus to all of us, and how the pandemic is impacting women more than men. I'll also try to outline certain measures which we need to be taken immediately so that we can cope with this situation and build a more equitable society. Let us first try to understand what is the term pandemic. A pandemic is an infectious disease that spreads across a large region and affects a substantial population. When we talk about pandemics, it is not that we did not have any pandemics earlier. We have all read in our history books about the plague, the cholera, the Spanish flu, and outbreaks of various other pandemics such as the SARS, MERS, Ebola recently. However, the COVID-19 pandemic has shaken up the entire world and is creating panic globally. Very simply put, the COVID-19 is basically a small invisible virus which is creating panic in one of the most intelligent communities or species found on Earth, that is human beings. The COVID-19 pandemic is a defining global health crisis of our times. This pandemic is more widespread than any of the earlier pandemics, and this is because of the increased interconnectivity among the different countries. It is one of the greatest challenges which we have faced since the Second World War. And what we need to understand is that it has not just remained as a health crisis, but has also become an unprecedented socio-economic crisis. It has created devastating social, economical, political, and psychological effects on mankind. This is bound to leave very deep and long-standing scars on our society. Now let us try to have a look at the impact of COVID-19 on society. COVID-19 is more dramatic, more global, and more unusual than anything which we have seen in our lifetime. Whenever a crisis occurs, it is usually laid upon the existing or pre-existing fault lines of inequality, poverty, and injustice. The COVID-19 pandemic has managed to highlight these inequalities in our society. It has exposed the weaknesses in our social, political, and economic systems, and thus amplified the impact of the pandemic. Women have borne the brunt of the socio-economic fallout of the pandemic, and in a situation where movement is restricted, where women are facing a huge range of challenges. The magnitude of the impact on women has multiplied many folds. Let us very briefly have a look at the impacts on different spheres of our society. The economic impact. The pandemic has hit the globe irrespective of which nation or which race you belong to. The world economy is plunging towards a global recession. Across the globe, and more so in India, women earn less, save less, and hold less secure jobs. Almost 70% of women are employed in the informal labor sector, and women perform 3 times the amount of work, unpaid work, than when compared to men. But this has resulted in a dip in the women's income, and it has impacted the participation of women in the labor force. Now coming to the health impacts. And this is one of the spheres where Indian women have been impacted the most. They have been deprived of access to quality health services, essential medicines, vaccines, maternal and reproductive health care, especially in rural and marginalized communities. Now, generally, the trend all over the globe is that women have had a biological advantage and been protected from COVID-19 when compared to men. But in India, we are moving contrary to the global trend, and we have seen that though there may be more number of men affected by COVID-19, the relative mortality due to COVID-19 is higher among women in India. So this is something which we all need to be really worried about. Almost 3.3% of women compared to 2.9% of men who are affected by COVID-19 are succumbing to it. This is mainly because of social determinants like not having proper access to good health, hygiene, and nutrition. And that is why we are defying the global trends. Women make up nearly 70% of the health workforce. That is, they are performing roles as health professionals, whether as nurses, midwives, or as health facility service staff, that is the cleaners, the cooks, caterers, etc. And that is why they are and they are increasingly being exposed to the disease. Next, when we look at the sphere of unpaid care work, I think all of you will agree that women are usually working and playing a major role, but most of this work goes unnoticed, it is unpaid, and it is almost invisible. Across the globe, 60 to 80% of caregiving is done by women. And in addition, during the crisis, when women take on the roles as leaders in their communities, as frontline services, they come forward and work, even this is not actually appreciated. The burden of the household chores, provision of food, child care, home schooling, caring for the elderly, for the sick, and even those who are affected by COVID-19 is almost being, the entire burden lies on the shoulders of the women. Women are working 3 times more in unpaid care work when compared to men. And this is a gross imbalance in the gender distribution of work, which leads to various stress and tensions among the societies. Another important sphere where we need to work upon is gender-based violence. Violence against women and girls is increasing globally and more so in India. This, along with the economic and social stresses, leads to a lot of mental health issues also. The levels of domestic violence have risen as people are being forced to live 24/7 in their homes without having walls to relieve their stress and tensions. The increase in instances of domestic violence has gone up from 30 to 40% during the pandemic. India is a very poor country. We generally tend to live in crowded houses, in cramped spaces, and this has led to a rise in domestic violence. Domestic violence and sexual exploitation. These are 2 main areas which need our urgent attention as more and more women and girls are succumbing to it. We are seeing not just a spike in the domestic violence, but we are also seeing that there is a fundamental rethinking about the role of women in many societies and communities. This is a very serious issue because this will lead us back to the 50s when women were living in the house and men were going out to work. And all the steps of development which we have taken in all these years may roll back. So we really need to think about this issue. Another important area where women and girls are facing a lot of problems is access to education. Girls have to overcome multiple hurdles related to access to education. They are more likely to be deprived of education when compared to the boys. And those girls who have missed out on schools due to the closures, due to the lockdown, are less likely to go back and join their campuses when compared to their male counterparts. So now, after having very briefly gone through what all effect or impact, in what way the COVID-19 pandemic has impacted our lives, I'd like to just briefly try to outline a few changes, lifestyle changes which we need to bring into our life. Now, when we try to understand the meaning of the word lifestyle, it is nothing but the way we live. How we live in our personal lives, in the society, all this, it is a quite a wide word term which can be used in a comprehensive manner. So here I won't be actually stressing on the personal lifestyle changes because I think all of you are aware about it, about how we need to maintain our health, take care of our health, maintain hygiene, follow social isolation, follow isolation, social distancing, and all these other things. So I will be concentrating more on the changes which we need to bring in on the community as a whole, and the government, which needs to make the policy decisions. So what kind of changes they need to bring in. So we'll be stressing more on these aspects. Now, the most important thing which we need to realize is that generally when we are talking about changes which will be brought about in our society, is we say that these changes will be brought in after the pandemic is over. But we need to realize that no matter how many vaccines are developed, the COVID-19 is there to stay. And we need to learn to live with the COVID-19, not after COVID-19, but how, in spite of its presence, we can go along with our daily activities and continue on our path of progress and development. Now, what should our response be at present? We have seen that most of the problems which we have discussed till now were pre-existing problems, and the pandemic has only managed to magnify and make it worse. Now, this is the time that should be used as a moment to reimagine, refocus, reshape our ideas about genders. Reaching equality in our societies should be our mission, especially gender equality. Because until and unless we have a society which is equitable in every aspect, we cannot manage to establish peace and harmony in our society. Now, there are three or four main areas where we need to work upon. Firstly, we need to involve more and more women in the planning for the COVID response plans and help them participate in the decision-making process. Whenever policies are made without consulting women or without including them in the decision-making process, they are usually found to be less effective. Any COVID response plan needs to have a gender lens applied to it. More and more women need to take up stronger leadership roles, participate more in the decision-making process, and it is only then that we can find ways to tackle this problem and this situation. So developing a gender-conscious approach at every level is one of the most important need of the hour. And another important thing is about the economic reforms which need to be brought in. Now we can see, or we have already discussed, as to how in the formal economy, most of the jobs which are carried out by women, such as teachers, nurses, are generally underpaid when compared to the other sectors. At home, the bulk of the work which is taken up by women is unpaid and invisible. So until and unless we play an instrumental role, we cannot have an economic reconstruction. So we need to involve women and we need to ask them to participate. We need to realize that women are and have to participate both in the paid and the unpaid sector, and proper reforms need to be brought in, keeping in mind the changes, the problems which women generally face. So making economic reforms is, I think, a major step towards empowering women. Another important sphere is having proper socio-economic conditions, or creating and cultivating stable, peaceful atmosphere for everyone, and especially so for women. It is time that we learn to acknowledge, to celebrate, to empower champions of peace and harmony in the society. It is time that we learn to appreciate goodness when we see it around us. It is time that whenever we are framing any policies, taking any decisions, it needs to be done with an eye towards how it is going to impact women. So any social assistance program, it should aim towards greater equality, towards providing equal opportunities, and towards providing social protection to women. I think the most important sphere where we need to really work upon is education. It needs to be prioritized during this crisis or during the pandemic. The only way to empower women is through good education. The best way in which we can defend a woman's rights is by giving them proper education, by giving them an education which makes them financially self-reliant, by giving them an education which helps them to raise a political voice, by giving them an education which emboldens them, which gives them the courage to speak up against injustice, and by giving them an education which creates confidence in them to stand up on their own. Until and unless we have strong, powerful, well-educated women, only such women can change this world. So we all need to realize that for a better world, we need to develop strong, powerful, well-educated women. So I'd just like to conclude by saying that COVID-19 is one of the most global and universal experiences which all of us are facing. We are all in this boat together. It is not only a challenge for our health systems, but also it is a test of the human spirit, of our resilience. Times of crisis can be times of transformation. So instead of being depressed about this pandemic, what we all need to do is take this up as an opportunity and try to transform our society, erase the inequalities present here, and try to create a better society for ourselves. We have to rebuild our society, and we need to address gender disparity foremost. Generally, when we talk about bringing in reforms, we say that we have time. In a period of 10 years, we'll be doing this. In another 50 years, we'll be able to make these reforms. But I think we no longer have the luxury of time, and any reform which needs to be done now. Until and unless we know this urgency, we understand this urgency of this situation, I don't think we'll be able to really make proper policies. So we need to immediately start and try to bring in the changes in our lives. There is a saying, never waste a crisis. And so we need to understand, accept the reality, and adjust accordingly. All of us, I think we have understood, seeing the situation around us, that women are the most hardest hit by this pandemic. They had the sufferers, they have suffered the most. But at the same time, it is these very women who can play a very important role in the recovery of the society from this pandemic. So they need to be given more importance, they need to be given better roles, they need to be recognized, and they need to be given a chance, a platform to participate in policy making, in decision making, if we want to create a better world. An integrated global response with a gender sensitive approach. This is the best investment which we can do for our future. So until and unless we integrate all components of our society, and especially when we have a gender sensitive approach, this will be the only way in which we can have and create a better society. So I think it is high time that we realize that not everything is not gone. We have not lost everything. This pandemic has been an eye-opener for us. People have started slowing down. People have started realizing that we are not just machines, we are humans. It is now the time to share, to care, to come back to the basics. Let us start practicing harmony. Let us start talking about peace. I think the best way to deal with the situation is that we need to become smarter, more sensible, and more sensitive. You can call it the 3 S's. This is the new mantra for us now. Smarter, sensible, sensitive. Smarter because all of us now, we are learning to use technology. I don't think any of us 6 months back would be thinking that we will be interacting in this manner. So, but we are all learning to cope up with the new technology. So we are becoming digitally smart. We are becoming sensible. That is, we are becoming more disciplined. We are realizing the importance of health. We are becoming more logical and reasoning and more sensitive. So I think all of us during this pandemic have learned to have this feeling of empathy, to realize the pain of others, to understand their suffering, and have a more kind, kind approach towards any situation. So together we can all overcome this COVID-19 problem. Um, I think I'd once again just like to thank the organizers for giving me this opportunity. I'm really very grateful to Sonar sir for uh, giving me this chance to participate in the webinar. So I'd just like to end by saying that let us all stay positive, stay healthy, stay safe, and stay connected. Thank you.